How schools can help prevent suicide among students. Suicide is one of the leading causes of death among young people, and it's a deeply tragic and complex issue that requires a multifaceted approach, especially when it comes to prevention. For many students, school is more than just a place of learning. It's a central part of their social world, where they build relationships, face pressures, and encounter both academic and personal challenges. Given this, schools have a critical role to play in suicide prevention and supporting the mental health of students. Recognizing the signs of struggle. The first and most important step is recognizing the warning signs of suicide and mental distress in students. These signs are not always obvious and can vary from one student to another. However, common warning signs can include sudden withdrawal from friends, family, and activities, drastic mood swings or extreme sadness, expressing feelings of hopelessness or worthlessness, changes in academic performance or attendance, giving away personal items or making final arrangements. While these signs can sometimes be seen as part of growing up, they shouldn't be ignored. Teachers and school staff should be trained to recognize these signals and take them seriously. By being attentive and supportive, schools can identify at-risk students early and offer help before a crisis point is reached. Creating an open dialogue around mental health. For many students, discussing mental health is still a stigma. This is particularly true for teenagers, who often feel pressured to hide their emotions or struggles for fear of judgment. Schools can work to break down this stigma by creating an environment where mental health is talked about openly and without shame. This can be achieved through curriculum integration. Schools can incorporate mental health education into their regular lessons. Subjects like health education, social studies, and even literature can be used to introduce topics such as anxiety, depression, and coping mechanisms in a non-threatening way. Awareness campaigns. Hosting events like Mental Health Awareness Week, where students can learn about the importance of mental health and how to seek help, can open up conversations. Peer support programs. Creating safe spaces where students can talk to trained peer counselors can help students feel more comfortable reaching out for help. Point 3. Providing access to professional support. Sometimes students need more than just a conversation or a caring teacher. They need professional support. Schools can play a pivotal role by ensuring that students have access to mental health professionals, such as counselors or psychologists. Having mental health professionals on staff is essential. They can offer individual counseling sessions for students struggling with personal issues, whether related to family problems, social pressures, or academic stress. Run group therapy sessions for students dealing with anxiety, depression, or grief. Provide resources and strategies for teachers and parents on how to support students with mental health challenges. In addition to providing on-campus resources, schools can also partner with local mental health organizations to ensure students have access to external support when needed. 4. Fostering a sense of community and connection. One of the biggest contributing factors to student suicide is isolation. Students who feel disconnected or who lack a strong support system are at a higher risk. Schools can help mitigate this by creating a sense of belonging and connection among students. This can be done through extracurricular activities. Encouraging students to get involved in clubs, sports, or creative outlets can help them build friendships and find a community where they feel accepted. Inclusive culture. Creating a culture of inclusion and kindness within the school can make students feel safe and valued. This involves discouraging bullying, promoting respect for diversity, and teaching empathy. Student mentoring programs. Pairing younger students with older mentors or providing opportunities for students to help one another can create a strong support network. Building coping and resilience skills. Resilience is the ability to bounce back from adversity, and it's something that schools can actively nurture in students. By equipping students with effective coping strategies, schools can help them deal with the inevitable stresses of life in healthier ways. Schools can teach stress management techniques. Simple tools like mindfulness, meditation, or breathing exercises can help students manage anxiety and stress. Problem-solving skills. Helping students develop skills to deal with challenges logically and calmly can make them feel more in control of their lives. Emotional regulation. Teaching students how to recognize, understand, and express their emotions in a healthy way can be crucial in preventing overwhelming feelings from escalating. When students have the tools to cope with tough situations, they are less likely to feel trapped or hopeless. Training school staff to respond appropriately. All school staff, from teachers to cafeteria workers, should be trained to recognize when a student may be in crisis and know how to respond. This training can include recognizing signs of suicidal ideation. Staff should be aware of the more subtle signs of suicidal thoughts, such as giving away personal possessions or writing goodbye letters. How to talk to a student in distress. Offering a supportive, non-judgmental ear can make a world of difference to a student who is struggling. Knowing when and how to refer, staff should know how to connect students with counselors, administrators, or outside resources. Creating clear protocols for suicide prevention. Having clear protocols in place ensures that schools respond swiftly and effectively in the event of a crisis. These protocols should cover immediate intervention procedures if a student expresses suicidal thoughts or attempts suicide. Communication with parents or guardians in a sensitive manner. Offering post-crisis support for both the affected students and the wider school community. By having these protocols in place, schools can act quickly and prevent further harm. 8. Engaging parents in the wider community. The role of the school does not end at the school gates. Engaging with parents and the wider community is crucial in suicide prevention. Parents should be made aware of the warning signs of suicide and encouraged to have open conversations with their children. Schools can host parent workshops on mental health and suicide prevention. Provide resources for parents on how to support their children. Partner with community organizations to expand mental health resources beyond the school. A community-wide approach creates a safety net that can catch students before they fall through the cracks. Preventing suicide among students requires a holistic, proactive approach. Schools can play a key role by recognizing the signs of mental distress, fostering open conversations, providing professional support, and creating a supportive, connected environment for students. By equipping students with the skills to cope with life's challenges and offering timely interventions, schools can help protect the mental well-being of their students and prevent the tragedy of suicide. Every student deserves to feel seen, heard, and supported. And when schools step up, they can be a powerful force for saving lives.